All right, ladies and gentlemen, while I think the last 2, 3 days have been very celebratory in nature for that matter, we celebrated the Father's Day. Yesterday, we celebrated the International Day of Yoga, and I'm sure it was like busy for most of you because, this is an art of incredible India. And when we talk about yoga, it's all about holistic well-being. I just got that connection because I think the social media is flooded with how we acknowledge health per se is so important. And especially, of course, when we say women are nation builders, their health has to be definitely not on the back burner, but right there to be focused upon. Our upcoming guest of honor address, ladies and gentlemen, as I said, would ensure optimum healthcare facilities to women. How do we do that? Well, if I do a bit of context setting around this, theme that our guest of honor would be taking up, what can really be done to ensure that we first recognize those needs and then develop the effective and sustainable programs to remove those barriers that have been existing? We have acknowledged it, and this would be a step towards achievement of optimal health for Indian women. So yes, I would like to believe that everybody watching us are cheerleaders who believe in this primal thought, right? So the address that's coming up by our eminent speaker will go on to very importantly focus on the evolving healthcare facilities for women, the women healthcare policies in place, absolutely, and as planned challenges in the adoption as well as execution of the required collective collaborative efforts. Ladies and gentlemen, I am specifically pleased to be inviting up next on the screen with some, again, very happy vibes, the one who is a pioneering, may I say, the biotech entrepreneur, a healthcare visionary, a global influencer, and a passionate philanthropist. Well, she's the proud recipient of India's highest civilian honors, the Padma Shri and the Padma Bhushan. Well, most recently, she has been conferred with the EY World Entrepreneur of the Year 2020 award. Well, there is so much more. I can go on talking about her. She's been appointed as a vice chair of the US-India Business Council in 2021. So many international, national accolades to her credit as well. Well, she's holding key positions in various industries, as we know, educational, government, and professional bodies globally. Ladies and gentlemen, as we say, let's make some very powerful round of applauses because they say, when you clap, it's good blood circulation. So we took everything that's healthy today, right? So let's give it up to welcome the executive chairperson, Biocon and Biocon Biologics. Let's welcome Kiran Mazumdar Shaw.
Good morning, everyone, and thank you for giving me this opportunity to address you all on such an important topic. The 2020 Global Gender Gap Report ranked India a dismal 112 out of 153 countries, using pre-pandemic data measured across 4 key parameters of economic opportunity, political empowerment, educational attainment, and health and survival. In fact, when it came to basic health parameters such as sex ratio, malnutrition, and life expectancy, the 2018 report of the same study ranked us at the 3rd lowest in the world. This is simply unacceptable for us as a country, for us as people, for us as a society, and for us as women. We have to do all that it takes to change these rankings. We have to move up with a sense of responsibility and with a sense of urgency. We simply cannot accept such dismal and shameful statistics. The pandemic, in fact, has only exacerbated this divide, making it yet more unhealthy to be a woman in India. The gender gap in vaccinations is even worse, the sex ratio that we see in the country. You will be shocked to know that when it comes to accessibility to vaccination, only 867 women have got the shot for every 1,000 men, with the exception of 3 states, and you can imagine which these are, Kerala being one of them. In fact, this ratio is even worse in many of our northern states. Unfortunately, we as a country have failed our women, even in vaccination deployment. We cannot simply accept this as a country, as a nation. Women have to be given equal opportunities and equal status when it comes to these major indicators of health and education. In our country, women comprise 48% of the population but contribute only 18% to the country's economic output. So again, access to jobs and employment is another major issue in terms of gender parity. And here too, unfortunately, the pandemic has delivered disproportionate devastation when it comes to women. According to an analysis conducted by McKinsey Global Institute last year, women are more vulnerable and susceptible to COVID-19 related economic effects because of the already existing gender inequalities. The study estimates that female job losses due to COVID-19 are about 1.8 or twice as higher than male job losses during COVID. According to the Center for Monitoring the Indian Economy, the already low labor participation rate for women has shrunk even further during the pandemic to 11% compared to 71% for men. Again, this is shameful and reflects the huge disparity that we have between providing job and employment opportunities to women versus men. And now that economic revival is going to be slow, winning back jobs, getting back jobs, obviously is going to be the prerogative of men more than women. And yet, the importance of delivering affordable healthcare and delivering it equitably cannot be understated. The Economist wrote as early as 2006, forget India, forget China and the internet, economic growth is driven by women. Healthier and empowered women in supply chains create wider economic opportunities for themselves and society at large. We all know that women reinvest up to 90% of their income into their families and communities compared to just 40% when it comes to men. Even when it comes to leadership demonstrated during COVID and the efficiency of COVID management, I think women political leaders stood out. Example, countries like New Zealand, Taiwan, Finland, etc. fared well as their decision makers were empathetic, pragmatic, decisive, and more importantly, willing to listen to real experts. They acknowledged the severity of the situation and acted swiftly, visibly, and with confidence. There is enough evidence now to show that in times of crisis, relational leadership or empathetic leadership is more effective than a command and control model, which only instills fear into society and doesn't get the right response from society. Another McKinsey study estimated that if women were able to participate in the workforce at the same level as men, this would lead to $28 trillion additional influx into the global GDP by 2025. There are enough statistics, metrics, and studies to show that women do matter when it comes to economic development, economic growth, and therefore it is so important for us to focus on economic development for women. There have been several initiatives during the past few years to bridge the healthcare access gap. India today has about 76,000 health and wellness centers which screen for NCDs such as hypertension, diabetes, breast, oral, and cervical cancer. And it's interesting to note that the majority footfall in these centers are women. Adolescent-friendly health services have also been launched to sensitive female adolescents on their health, including the LGBTQ community. Auxiliary nurse midwives are also being made available in villages, and ongoing schemes for maternal care, including the Jananayani Suraksha Yojana and the Pradhan Mantri Matru Vandana Yojana, which has crossed over 1 crore beneficiaries, has also been achieved. There is also a massive fiscal stimulus package offered by the central government aimed at providing support to the vulnerable groups. However, this is not enough. There needs to be more holistic approach from the government when it comes to health and healthcare providers and society in terms of taking positive action. And this must include families sharing household responsibilities, encouraging self-care for women, looking after mental health, diets, nutrition, provision of financial assistance, and flexibility from employers, especially in view of the hybrid working models that have developed during COVID. Of course, another very important enabler for women is technology. We must use the power of technology and innovation to bridge the access gap. Rural India has a huge untapped resource pool of close to 9 lakh ASHA workers. In fact, it is these ASHA workers who have done a phenomenal job when it comes to COVID management. And they have actually played a very important role in acting as a bridge between the government and the people, and are playing multiple roles of healthcare facilitators, health activists, and service providers, and are operating most importantly at the grassroots level. Digital enablement of ASHA workers can vastly improve accessibility whilst also reducing the pressure on the system, catching disease early and capturing vital data. Even during the pandemic, using ASHA workers to assist in vaccine deployment, to send the right messaging to remove vaccine hesitancy, to ensure that we collect the right data that puts us in a safe place in terms of even vaccine or pandemic surveillance is extremely important. And I think ASHA workers have proved time and time again that they can do this. And with better technology enablement, they can actually have a very strong career path and can contribute significantly to economic development. Without the participation of women in active economics, India's dream to become a coveted $5 trillion economy by 2025 recedes further into the distance. The gender lens remains a vital piece, still not getting its due in policy making and developmental initiatives. It is imperative for us to convert the thematic debate into a holistic, comprehensive, and most of all, into an inclusive path of recovery for India post the pandemic. Thank you.
Ms. Shaw, it was an eye-opener to witness those stats that you spoke about. But it was so, may I humbly say, so beautiful to note how you said empathy, discipline, and a lot of other virtues that you mentioned helps in relational leadership, and how relational leadership can together help the cause. So on that note, let's be humanizing in our efforts. Well, the stats may look alarming, but Ms. Shaw, thank you so very much for that confidence that you also instilled in us, and you're sending more power to you. Thank you very, very much. Well, ladies and gentlemen, we'll be very quickly heading into a special talk that's coming up. Well, the speaker is just waiting backstage to address all of you. Well, this would be about I think it's very topical because we're going to talk about mitigating the pandemic and also understanding the role of healthy women in it. I'll be right back. Just stay tuned. Of course, this is just a little breather for all of you to, put in those hashtags and express your views on social media. I'll be there right there.